Elliott. Okay, Bridget Malone and Melissa Milam. On deck is Toni Mills and Mary Munoz Davis. Any of them still with us? Yeah. So if I named one of the four of you, just come on up. Okay. And again, we've given some liberties to Ms. Lee and others, but we'd love for you to stay within a 3-minute time period right now.
I appreciate that. Thank you.
My name is Toni Mills. I live in Mesquite, Texas. I'm representing myself, and I am for this House bill. Prior to moving to Texas in January, I lived in Washington State and worked in the healthcare field for about 28 years. I have a background in family practice, primary care, as well as a surgical background in labor and delivery. My story is pretty similar to some of these people. I had a work injury, fell at work, was put on multiple medications, went back because I was having problems, side effects from the medications. I was given more prescription medications, got sicker and sicker, ended up with 4 peptic ulcers, precancerous cells. Then the steroid injections started on my spine, and then the marijuana prescription. I was willing to try anything. 2 days after I took the marijuana, I got my life back. The symptoms continued for about 2 years, and it was suggested to me that I try medical cannabis. Now, mind you, in the medical field, it was beat into our heads that this was the gateway drug, and it petrified me. But I was desperate. I was down to 90 pounds. I was a single mom with a traumatic brain injury child at home, and I was vomiting dozens of times a day, and I was dying. So I climbed into my car with all of my medical records and a big bag full of prescription medications, and I went down to Seattle, and that was the first day that I took back control of my health care. Within a week, I was not having any more vomiting. I was a legal patient up until January when I moved here, and was off of all of my medications and only had to take nitroglycerin for breakthrough spasms and occasional narcotic at nighttime for sleep. I have a large list of drug allergies. I cannot take synthetic meds, topical, anything on my skin, sensitive to everything. Not everybody can swallow a pill. So at that point, I decided that I needed to educate people about cannabis, and I started volunteering at a medical clinic that authorized patients. I have seen patients from pediatrics to geriatrics, patients with seizures, MS, cancer, autism, PTSD, wounded soldiers. Medical cannabis works for all of these patients. It was the only prescription that a patient is completely in control over. They can use whatever form they want to, as little or as much as they need to, and they are never at risk from dying from overdose. I cannot tell you the same with the prescription medications, the narcotics, and the other benzoids and all the other dangerous medications that my provider prescribed to patients. I can still tell you the name of the first patient that I lost to accidental overdose. And it is refreshing to know as a healthcare worker that when I give a patient information on medical cannabis and they walked out our office door, I knew that they were not ever going to die from that medication. Patients such as myself should not have to risk going to prison or losing our children because we choose to use an alternative medication that is safer for me than any other of the prescription medications that I was prescribed. Thank you for your time and for coming out with this bill. I appreciate it.
Excellent. points. Thank you.